Great. Good morning. I think I know everyone in this room, but in case we've only emailed or spoken on the phone, my name is Abra Lyons-Warren. I'm the Senior Program and Policy Manager at CLPHA. I work on our Housing Is initiative, which is the reason we are all here today. So as you just heard from Stephen and Sonia, it's been truly amazing to see how this work has evolved over the last several years. For some of you, this is your fourth summit. For some of you, it's your first. We're very glad to have everyone with us. I'd also like to welcome those of you joining us via our live webcast. The first year that we're doing that, we're excited to be able to bring this to a wider audience. As you've heard, this event is really meant to bring together the housing sector, the education sector, the health sector, all the existing and potential partners in between to foster new partnerships, strengthen existing ones, and give you tools and resources to bring back this work and continue to support it for your own efforts and in your broader community. So just a quick couple housekeeping remarks. I'd like to take this time to remind you, you may have noticed in your folders that there are session evaluation forms. Those are on the left-hand side. There's one for today and one for tomorrow. We strongly encourage you to fill them out after each session, but at the end of the day, please put it in the box on the registration table or give it to any CLPHA staff person. You might have also noticed that I am not Ben Carson. We had a last-minute switch in our schedule, so in just a moment, you'll be hearing from our esteemed panelists for our plenary session on anchor institutions. Then we will have our keynote presentation, and the rest of the program will continue as scheduled. Just a couple other notes. We'll indicate when we're moving into breakout sessions. You'll also notice air walls coming down, so just be mindful of bags or persons in the way. During Q&A sessions, we will have handheld mics, so we'll make sure to get one to you. We also have index cards on the tables, so if you'd prefer, you can write your name and your organization and your question on the card, raise it up, and a staff person will come and collect that. I've heard that there have been a lot of questions about the Wi-Fi password, so that is in your program, your agenda, on the second inside page. And then the bathrooms are located, just keep following the hall around the corner here. We hope that this event is useful and moves your work and national efforts forward. Please share your thoughts with us on social media. You can find us on Twitter using hashtag HousingIs2018, as well as the Housing Is handle and the CLPHA handle. We're very glad that you're here. Now, I'm pleased to invite our Anchor Institution plenary session to the stage. Thank you.
Well, thank you, and good morning. I'm going to sit rather than stand at the podium. This is going to be very much a discussion to lead off today for this really tremendous program that you have, I think, over the next couple of days. I've been working in this field for a good while, and I think you touch on all the issues that are really important in this area. My name is Stuart Butler. I'm a senior fellow at the Brookings institution. And as part of my work there, I actually run a monthly group of people, which includes often Sonia and Steve and others from CLPHA, but others too, which brings together people from different sectors: education, health, social services, housing, and from different kind of walks of life, people who are researchers, policymakers like myself, or policy people, and practitioners. And what we do is really get together and think about what are the main ingredients to really get cooperation and collaboration across sectors in order to improve the medical health, the physical health of people within communities, but also the health of communities, the economic health, and social networks, and so on. And it's always an interesting conversation. And one of the interesting things about it is that certain themes become evident over the meetings. For example, the importance of data and data sharing, to enable different sectors to work together. And of course, in the program, you're going to be looking at that later on. And in addition, one of the things that really has come through very strongly is the importance of certain institutions in the community. Different institutions, sometimes in different communities, hospitals sometimes, schools, housing authorities, churches, certain institutions that we loosely call anchor institutions that really seem to be critically important as a catalyst or as a partner, as some kind of hub to really help other things going on in the community to come together in a successful way. And that's what we're going to be looking at pretty well throughout the program, but particularly this morning in this panel. And these institutions, as I say, can be varied. Sometimes in certain communities, an unusual institution takes the lead. Sometimes institutions work in partnership with each other within communities. So we want to explore this in this conversation. And certainly housing has, I think, attracted in the last few years much greater interest as a hub, as an anchor institution within the community. There's been a lot more work in this area, a lot more interest. We certainly see in our conversations this becoming more and more a common feature. It makes a lot of sense, as you know. As they say, housing is where people are at. Housing is often a very convenient place to provide services and to coordinate them. And housing has a tremendous economic impact within different communities. So it's not a surprise in a way, but it's certainly very gratifying that we're seeing housing as a hub or an anchor institution attracting a lot more attention. So I said we're going to have a conversation about this with our group of panelists today, and I'm just going to introduce them very, very briefly. You do have information in your program on them, so I'll just touch on it very quickly. First of all, Valerie Piper, right next to me, who's Vice President of Engaged Practice at Democracy Collaborative, where she oversees and provides strategic guidance to community wealth building projects and services across the country. She was previously, by the way, from 2011 to 2017, as Deputy Assistant Secretary for Economic Development at HUD, where she led the development and launched the Obama administration's Promise Zones initiative, something that I worked on actually prior to that, many years earlier. Next, we have Charles Rutheiser, who's Senior Associate at the Annie E. Casey Foundation, which is a major foundation, as you know, based in Baltimore. He's a Senior Associate for the Center on Civic Sites and Community Change. And I would just mention that he's also the founding co-chair of the Anchor Institution Funders Group of the Funders Network for Smart Growth and Livable Communities. And last but by no means least, Sue Popkin, who's director of the HOST initiative, which I shall say a little bit about in a minute, at the Urban Institute. She's a senior fellow in the Metropolitan Housing and Communities Policy Center and director of the program on neighborhoods and youth development at the Urban Institute. So I'm going to start with just a question to each of the panelists to have them talk for just a couple of minutes about a certain aspect of their work and their views on the anchor institutions. And so let me start with you, Valerie. Democracy Collaborative has been involved in a wide range of anchor institutions and making them work. If you would, first of all, can you just tell us a little bit about that work? And then also what maybe 2 or 3 of the major takeaways have been from your work in this area?
Well, it's actually a great, technically a little challenge here. There's a button, okay. So the Democracy Collaborative was started in 2000 with as a think tank with a consultancy attached, if that's a fair way to characterize what we do. I oversee the consultancy. And we're dedicated to inclusive economic development and in a number of different ways. But the anchor institution work has grown out of our sort of flagship initiative in Cleveland, in which anchor institutions such as the Cleveland Clinic, Case Western Reserve, universities, hospitals, University Hospital, And the museum and others came together to start with the Cleveland Foundation to start to look at ways of revitalizing 7 very distressed census tracts surrounding that university circle of institutions. And that initiative has grown into something where each of those institutions is inflecting some of the hiring for entry-level jobs, working with partners to train people for those jobs specifically and provide professional development inside the institution once they come. They're inflecting purchasing to support small business. And they're also doing some, longer-term investment work in the surrounding communities. The Democracy Collaborative was also instrumental in helping start up cooperative businesses so that workers in organizations like a commercial laundry that services all of those institutions actually own a piece of the business, right? So we're trying to do traditional economic development with a twist. If you think of traditional economic development as sort of getting Amazon to come to your town and hire a whole bunch of people, looking at anchor institutions as being those sort of larger nonprofit and public sector organizations that aren't going to go anywhere, that have a different relationship with the community, a different governance structure around where they make their location decisions, and hooking that up with broader ownership opportunities for lower income people. And so the sorts of folks that now are building assets through their jobs have significant barriers to work in the greenhouse, the solar installation business, and the commercial laundry. So exporting that package to other places, we run an advisory services unit that actually works with local institutions that are trying to come together in that same way and just figure out where to start, whether it's local purchase, local hire, sometimes investment of either endowment funds or using linked investments with CDFIs to leverage more funds into the community, things like that. We are seeing an uptick, particularly among health institutions, in looking at housing in that way. And we also support 2 important networks that have emerged in healthcare and higher education. The Healthcare Anchor Network, which now has 36 national health systems representing hundreds of hospitals. And they're all coming together. It's their conversation. We're kind of facilitating, supporting, helping them develop tools and products for their industry. And they're looking very specifically at how they can use the things they do every day. They buy stuff, they hire people, they move money around, right? So they're looking at how they can more effectively impact the populations that they serve and tying that directly to a population health outcome. And thanks to Charles, in large part, who's been a champion of anchor work for decades, can I say it that way?
Actually, scarily, yes.
Yeah, decades. Charles has been a formative supporter of our work with universities. So we just partnered with the Coalition of Urban and Metropolitan Universities to launch a 31 university cohort of universities that are starting to look at the same issues. So that's emerging from work on impact data that many of the leading universities in this work were doing, thanks to Charles, for several years. So that's what we do.
Thank you. Charles, as Valerie mentioned, you've been very much involved in not just funding organizations, but particularly looking at universities as anchor institutions. Can you just elaborate a little bit on that? Tell us a little bit about the role of universities.
Sure, definitely. And let me just, by talking about CLPHA, the CLPHA Foundation, is focused on improving outcomes for children in the United States. More than 25 years ago, we recognized that we wouldn't be able to achieve our goal without focusing on improving the communities in which kids and their families lived. And when we started getting deep down into this work through making connections and other investments, and we were in almost 24 cities around the country, we noticed that in many of the poorest, most disconnected neighborhoods, a large university or hospital was located either in or adjacent to the boundary of that neighborhood. And there were these entities, however big and full of activity and assets as they were completely disconnected from the community. They were in the community, but not of it. They hunkered down behind walls, physical walls, but also a set of mental walls within the minds of the people living on the other side of the street, as well as the staff and students that were inside these institutions. And in many cases, these institutions were focused on communities 2,000, 3,000 miles away, then 500 feet, literally, across the street. And it struck us that this was a tremendous waste of assets, and that the power and potential of universities and hospitals located in these neighborhoods was largely untapped. Now, when I say largely, not completely, because while the same erection of mental and physical barriers happened in the 1960s and 1970s, numbers of students and staff and researchers, the boundary was permeable. We were able to sort of go back and forth. There was some community benefiting and serving programs. Unfortunately, there were also some rather experimental programs that treated community residents like experimental test subjects, which really helped intensify the divide. But beginning in the 1990s, and I think one of the key sort of moments here in the 1990s was when HUD created the Office of University Partnerships and the Community Outreach Partnership Center grant program to help facilitate new ways of the universities engaging with communities outside their gates. Also, in the mid-1990s, the University of Pennsylvania began to recognize the futility and the paradoxical effects of its defensive-minded strategy, and said, you know what, we can't move, which is a hallmark of an anchor institution, but we have to do a very different way. We can't keep erecting barriers, and we need to create spaces of connection and bridges. And they went ahead and did it. And this became incredibly inspiring for a number of other universities in other older industrial cities in the Northeast and Midwest, where healthcare and higher ed really were the main drivers of the local economy. 33% of all jobs in those two sectors. And that notion, put together with the HUD University Partnership and the model set forward by University of Pennsylvania, inspired other institutions, other large privates like Johns Hopkins and University of Chicago that had also historically tense relationships with their surrounding communities. But it's not just limited to, and this notion about trying to make much more intentional strategic use of all of the assets that were at the disposal of these institutions, not just the brain stuff that was in the heads of students and staff, but the money, the way in which these institutions invested their capital, hired people, and bought goods and services. And that was the beginning of the modern anchor institution movement. And we see this not just in large privates, but large publics as well. Faith-based universities, historically black colleges and universities, and especially the higher education anchor initiative there. We have universities of every kind over every region in the United States. So over the last 10 years, anchors has gone from being a buzzword to something more of a term of art. Something that went from being an externally imposed category by social scientists to a term that is embraced and used to self-identify an institution that is committed to doing things differently in partnership with community.
Fantastic. Thanks very much. We mentioned housing as an anchor institution and the growing importance of that. And by the way, you have on your desk a study that we did at Brookings just very recently, which draws on our work that I mentioned earlier, looking at housing as a hub and a number of the issues associated with that. But Sue, you've been working with housing for a good while, of course, at Urban and as with the host network. Not decades, a while. That's a very permeable, very elastic concept. But anyway, you've been working in this area. Could you say a little bit about your experience as looking at housing as a platform and as an anchor institution in our communities?
So yes, I think specifically I'm going to be talking about housing authorities, which many of you represent as anchor institutions and a way of delivering services and starting partnerships. So I direct what's called the HOST Initiative at the Urban Institute, which stands for Housing Opportunities and Services Together. HOST grew out of other research we had been doing for that decades business that we were talking about the needs of public housing communities, and from our experiences in partnering originally with the Chicago Housing Authority on developing services and delivering them to residents in the community where they live. And I think that's a key part of HOST that's very important to keep in mind. So HOST is high quality services that take a whole family approach. We had been doing a lot of work with a very high-quality case management model with low caseloads, and we thought, and Charles was my program officer, and we saw some great outcomes for the Chicago families who went through that, we saw that the parents' employment improved and their mental health improved, and surprisingly, their physical health stabilized too, which was terrific to see. Their kids were still struggling and still not doing well. And I think at the time, the field was starting to think about how do we do something that's more holistic and take more two-generation and see the whole family. And we just got lucky and had the opportunity to try with our collaborators in Chicago and in Portland by then. I think we brought you on at that point to think about how to develop a model that would be truly serving the whole family who lives in public housing, the adults and the kids. It's a real challenge because, as you know, public housing is one of the last sources of large units in any community. So most two-generation models are talking about one mom, one little child under the age of 5. In public housing, I think in particular, I think of our families in Portland who had kids from 0 to 18, and maybe 10 people in the household, and maybe 2 separate families sharing a unit. So it's, I think, takes a lot of thought and a lot of creativity in how you're going to be able to know what the needs are of that whole group of people and try to connect them to the right services. Host is not assuming that one person is doing all of that or one service provider is doing all of that. It includes coaching or case management, workforce programming for connecting people to workforce and education for adults. And I think one of the core pieces of Host that's very important is mental health services that come on the property. We have found everywhere we've worked that is just critical, that people have there's so much stigma associated with using mental health services, and people will not go until they really trust somebody. For the kids, because of that range of ages I was talking about, we haven't had a standardized service. The original housing authorities we partnered with for the original demonstration all ended up targeting elementary to middle school age kids, just because that's the largest number of kids on their properties, and also the ones high school students in a lot of cities are hard to get because they're going to schools all over the city, which I'm sure you'll be talking about when you talk about education partnerships today, what school choice has done to doing these kinds of partnerships. And so what the coaches were doing, their caseloads were low enough that they could know the whole family and make sure the families were connecting to the right services for their kids. And then they ran some special things for the elementary school age kids too, some after school groups, targeting mental health or health issues, doing some more interventions that way. I think one of the key things about Host is it takes an approach of the importance of meeting people where they are. This is a community engagement model. This is not coming in and saying you must do in order to stay here, or you must do to keep your housing. This is, what do you need? What are your goals? How can we help you get there? I think one of the stories I like to tell is a woman I met in Portland who told me that the real difference with Host was she'd been part of FSS before, and she was told she had to do certain things, and she said, but what I wanted to do was get my GED and then get my associate's degree so I could get a job that would pay enough to get us out of here. And when I met her, she had just walked across the stage with her associate's degree, and her kids had seen her do it. She was so proud, and she was about to start the job. So I don't know if she got out or needed to, but she at least had gotten to her goals, and she was really proud. I think another thing we have learned through Host is that there is just an incredible need to spend the time to build trust with people. Residents have been through a lot of programs. They've seen a lot of things come and go. The funding comes and goes. The staff come and go. They've been told that they need to comply with this or that. They've been, so there's a long history of programs and to overcome, I think, and really having staff who can take the time and spend the time just getting to know people before they say, hey, seems like you're having some issues here. Maybe you want to talk to my colleague over here about some of those depression things that you've been telling me about. And then it's really important, excuse me, to have services that are accessible and on the property. We have found, especially in high poverty public housing communities where there are a lot of longtime residents, people are really reluctant to go anywhere to get services. That they're afraid, they don't trust people again, they're afraid. There's a lot of stigma associated with being a public housing resident. They're afraid people are going to treat them badly. And so at least having somebody who can be to know them and do a warm handoff and make sure that they are feeling okay when they start the new program or new service. And then there's also a lot of providers who are reluctant to come on the properties because of the stigma. So I think it's sort of a two-way problem that HOST works to address. And then the questions I always get, this sounds like it costs a lot, it's hard to do, it's hard to be sustainable, and that's, I think, what we're all talking about is the importance of partnerships. Housing authorities should not be expected, should not have to do this alone. There are a lot of good social service agencies out there. They're supposed to be serving your residents already. Housing authorities have assets they can offer, like space, other resources, maybe some staff coverage, and helping them, so figuring out creative ways to partner. There are ways which my colleague Ray Parks can talk about much more articulately than I can about building in financing when you're doing your RAD refinance. There are other options for building in some kind of sustainable financing. And of course, as this question often comes up too, you know the MTW agencies have the greatest flexibility for shifting funds around, but we work with other housing agencies who are not MTW who have figured out creative ways to partner, and it's possible, and it's important.
Good. I want to pick up on your what you said towards the end in terms of the importance of building trust and these difficult relationships. And Charles, you mentioned earlier about hospitals too, but certainly universities often are walled institutions where there's enormous barriers. I wonder if you think of it from the perspective of the institution itself, a hospital or a library or a university. Are there some kind of do's and don'ts, or are there some kind of easy ways in which an institution can build the kind of relationship it needs to really operate as an effective anchor institution? I'll ask kind of both you and Valerie particularly on that.
If I can just offer one anecdote about don'ts, I guess.
Yeah, there's lots of don'ts.
We worked in a community that was adjacent to the University of Pittsburgh. And they were sort of using the housing, the mixed income community as housing for their students, or a little bit, and there was a complete disconnect. This is this huge resource that had a great world-class medical center and all kinds of things right there, and they were making, as far as we could tell, zero effort to have a real connection with the residents who had been there all along. And felt and were very worried because the university had just bought a new building and was putting in some offices and things in an effort to create a partnership, but they hadn't done the first step, which was, let's talk to the people who live here first and get to know them and make sure that they feel like this is a place for them too.
Unfortunately, it is neither easy or straightforward.
Right.
There's no shortcuts around it. It is hard, difficult work, and you need to necessarily have a very thick skin and some clear guiding principles in order to be able to navigate that. I mean, part of what you're dealing with also is the burden of the past, and not the far off past, but decades ago, that helps create these tense, conflict-laden relationships and raise questions and really create antitrust. In the worst sense of the term, where people on either side will think of themselves in the most malevolent way possible. And there's just no substitute to sort of pushing forward, but also acknowledging the past. In some of these universities located in inner city neighborhoods, they were built on urban renewal parcels. Right. Housing was demolished to make way for these big 1960s university campuses, and none of the current leadership was there then or even knew about that. But that memory lingers within the collective memory of residents, and even after they've been displaced, and it becomes one of those really difficult things to do. So, and folks in communities have heard people come in for decades going, now this time is going to be different. This is one of those things where words, really, they're important, but actions and the development of clear, intentional guidelines, and actually institutions being clear about their institutional self-interest, that they're not just doing this for charitable purposes, is absolutely critical to helping to build a sense of trust that has been destroyed by decades of problematic interaction.
Right. Valerie, you must have had similar experiences.
Absolutely. But I feel like I think Charles has hit it on the head. You just have to, it's so important to start by really listening. And so the people that we've seen in the networks that we work with that have been really successful in engaging folks over time I think it's important to be clear about institutional self-interest, also clear about timing, right? When are we going to do something? How do we make this better in terms of impact, or how do we understand what impact it might have and maybe make a different choice? Folks have a sense if they're outside these institutions, it's sort of a monolith. and it's going to sort of steamroll through what it needs to do. And there are some aspects of institutional behavior that do feel like that, even inside the institution. So I think one of the things that we tend to do is work with the champions of community engagement and community development, engaged development work, whether that's real estate or not, to help them carry the message within their institution about how those choices might be framed or made, and to get the folks that are responsible for the operations, sort of into the conversation early enough that there is a perception of engagement and listening at a different level. So you see a lot of folks sort of navigating within, a lot of folks here also work in large organizations. I'm not sure, pretty sure none of them are monolithic either, right? So it's like that navigator function becomes really important, and it's nobody's day job usually. So being able to support the people who are doing the translating and give them space, I think is really important as an institutional priority. Usually that has to come from the top. So.
I think, as you've all said, and Charles said this explicitly, that one of the challenges is to really indicate, if you're a potentially big anchor institution, that there is a mutual advantage in cooperation. Mm-hmm. And I think people are very suspicious of an institution that comes and says, we're just here to help you, just out of the goodness of our heart. That is important, but it's not sufficient, I think, to build up. And certainly in our work, not just on housing, but certainly looking at hospitals, in this area, it's sometimes a challenge for a hospital to actually see a long-term commercial interest in becoming involved in the community. I remember speaking to the head of a local hospital here and said, okay, so let me make sure I get this. We're supposed to invest in the community. We're supposed to spend money. And the effect of that is that fewer people need to come into our emergency room because we are actually kind of improving the community. This does not compute for our CFO. And I think one of the things that I've certainly found is that there are a lot of barriers that are due to policy, budgeting systems, and so on that make it actually very difficult. And I wonder if you all agree with that point, and whether there are some specific policy areas where you think that we could make some tweaks, some changes that would actually make it more in the enlightened self-interest of some of these anchor institutions to engage in the community, rather than seeing it simply as a philanthropic activity.
Yeah, that's a great question with many different complicated answers. In some cases, though, when it comes to policy, barriers, and when you actually get an institution saying, we're willing to target our hiring and our procurement in certain geographies, and if it happens to be a state institution saying, well, we can't do that, or if your state passes a preemption law that basically knocks those out, even if it exists at the local level, it becomes a real problem and hard barrier. But getting folks to acknowledge what the business case is, chances are, local sourcing is not going to make it cheaper than what you're getting now, but it should be no more expensive, and it also delivers an extra social return, which doesn't go to the institution itself, but the beneficiaries are the residents themselves that are part of it. I think in some ways it might be an easier case to make for hospitals and health systems. Mm-hmm. And I've noticed this in Valerie's network, Healthcare Anchor, because regardless of what happens to the ACA, many folks in medicine recognize that social determinants of health, the stuff that you get outside your medical care, has a tremendous impact on your lives. So people can get this notion, even if they're thinking about it in terms of community benefit or not. Whereas universities, in many cases, bring their populations from inside. I'm thinking here particularly about private, elite Research One universities. They come in and then they go away. And they're not sourcing their students from the local community. Their interest is to make sure the communities in which they live, are places that are not hostile, dangerous, toxic environments for people to live. And universities get the case that, we're not going to be able to attract and recruit staff and students if the neighborhoods that we live in are incredibly disadvantaged. And that becomes somewhat even more challenging for universities than for health systems administrators.
Do either of you want to add to that?
Well, I just was going to say that we are seeing, a real recognition of, what we call an anchor mission in both higher ed and healthcare institutions. And one of the things that is really gratifying as somebody who went to school in the 80s, right, is that community engagement and local stability and sort of looking at the local economy as a system is actually in now. So students demand that at a level that is really refreshing, and I think that has a market impact on some of these institutions. It's not as direct as what we're seeing in the health systems yet, but 31 institutions just signed up for this Anchor Mission initiative because they're already doing things and they want to do more and have higher impact. So I'm very hopeful for that. The other thing I was just going to say is, knowing that we're short on time, we actually do a lot of work with the institutions that we work with to kind of pull out case studies of what health systems and universities and other institutions are doing in their own language and conversation. So I believe it was Mr. Norman said, learn to speak other acronyms, right? So we've got some good translation materials that provide, peer cases for folks that may be talking to anchors in their communities that, are kind of practical toolkits. And, here are some people that have done this. Here's how they've done it. Was the investment program lodged with the community benefit arm of the hospital that has the philanthropic mission, or was it in the treasury? Right. And what were the relative advantages of those two things, and what did that conversation feel like? Things like that can help you kind of understand the other side of the table.
Just one quick follow-up to illustrate the difference between eds and meds. One of the things that's been so exciting about the healthcare work is that systems with dozens of hospitals each, and those 36, they have over 600 hospitals. At the level of higher education, it's individual institutions. It's not like you're getting the State University system in New York or the University of California system to take on those decisions at the systemic level. It's still very much at the level of an individual institution rooted in place, but it's born scaled. Which I think is one of the more exciting and encouraging developments.
And the other thing we see when we're working in a place is you usually have hospitals and universities that start to have, you kind of unpack that when a foundation does the convening, or a city or a housing authority does the convening. Often the mid-level managers who run procurement, or the folks that are in the hiring systems, are having the same gaps and barriers and challenges. And they may not know each other, because they're working within their own big system. But once you get them together, there are things that they can do collectively with partners more efficiently than they can do by themselves. And so when we engage as a consultant in these situations, we're often kind of finding those points where collaboration makes sense to start. Right. And then helping people learn to work together on those things. And, it's like any other community economic development partnership, right? You want to figure out where the initial problem is that people need to solve, and then get some quick wins and some momentum, and prove you can work together, and show the CEOs, and, keep building from there into other things that benefit the community. And once you get folks around the table, those things emerge pretty quickly.
Yeah, I'm going to open up for questions in just a second. But I should mention that when we start looking at the medical sector, yes, we talked a lot about hospitals, but as you go kind of further down into the community, into smaller clinics and so on, there's a lot of opportunities and a lot of activities in that area too. I chair the board of a local system here of community health centers called Mary's Center. And one of the things we're doing is utilizing telemedicine, actually sort of telemedicine hookups with people in their own homes. We're trying to expand that into having like mini clinics in housing authorities, in housing areas and so on. But as I said earlier, there are barriers to this. Medicare and Medicaid envisioned telemedicine as something you did for remote, rural communities, not for the person 4 blocks away who's got diabetes and is overweight and just cannot get to the clinic. We had to find all kinds of workarounds to
I think that's one of the issues, is the same trust issue.
Yes,
a lot
absolutely.
of the housing authorities we work with are adjacent or have even federally qualified health clinics on the property, and people are very resistant to using them because of all these issues of trust.
Absolutely.
And then their neighbors seeing them too. There's a lot of shame associated with using that. So that's
especially
one of the things.
for mental health and so on.
I was just with a group of host case managers a couple of weeks ago, and they said there were a whole group of kids they were working with who hadn't had their vaccinations, and they just called the clinic and got them to make a space for the whole group to come together so
Right.
they could just
Right.
have support.
You have to be creative.
Yeah.
Let me open up to questions, and please make them questions rather than long comments. Right. Do we have one? We've got one over here. I think we've got a microphone, right? Yeah? Oh, apparently not. Okay, so maybe I'll just, we got a microphone over here, maybe for this lady. Do we need microphones or? Yeah, because it won't pick up. Okay. This way you'll be recorded for posterity.
Okay. Good morning. Thank you for your dynamic panel presentation. I actually have two questions. The first is for Sue Popkin regarding the host network. How did the mental health services get funded? Because I know that's a challenge for us, and Housing Authority, City of Los Angeles. And we did a pilot demonstration at one of our redevelopment sites, and it was extremely expensive. And we had a little hiccup on getting mental health data due to HIPAA. So a lot of the outcomes that we were trying to seek, we were only able to capture it in the aggregate. We weren't able to really drill down. So that's question number one. And then question number two is, do the anchor institutions fund their own collaboratives? And how does that work get funded?
So you're right, mental health services are expensive and hard to fund, which again, I think is the importance of the partnerships with other, if you're working with a good social service agency that has clinical social workers that you can partner with, if you can give them some funding, if you can give them some space to bring their staff on site. That's the way that we've done it with hosts. There are, as I said, these clinics on a lot of the properties. In host, what they did was try to hand off to the providers in the clinic once they built the trust and report, especially for people who needed psychiatric care or medication. I think the data issue is huge. There is no way to track at this moment, other than asking people what benefit they got out of it. So we had the advantage of a well-funded research project to start, and we were doing a depression assessment of people and could see what had changed before and after, but it's a real problem. And other than if you're actually funding a partner at some level and you're asking them to report performance measures, the only thing they can tell you is how many referrals they made. And I think there's a nice data session this afternoon, and it's a real barrier for doing these partnerships.
It's definitely a blended model for funding. Philanthropy, both at the local, community, and national level, has played a key role in helping to identify, document, and disseminate learnings and best practices, and bringing peers together with peers, purchasing officers, university presidents, what have you. But I know certainly, with a modestly limited grant budget, to have grants go to very large, well-endowed institutions with a lot of money is not necessarily something that you think about doing. But in many cases, what we've seen is that anchors have made extensive use of their in-kind and have actually, once they adopt an anchor mission, have increased their investments in community-facing and community-serving programs, so that they are putting their monies, which they get from a variety of sources, sometimes from philanthropy, sometimes from local, state, and federal government, sometimes from their own endowment, to advance this work. So it varies tremendously. It is a challenge, though, for smaller institutions that are more dependent upon tuition, that have lesser margins, and where philanthropy is probably more motivated to come in, and not to serve a sustaining funding role, but certainly a catalytic role at the outset to get the ball rolling.
And if I could just throw in, I think one of the things in terms of partnerships with anchor institutions, students need internships.
Yeah.
Students need community practice. Some of the communities that we work with have made those kind of relationships with universities and social work schools and gotten people. I mean, it doesn't give you the long-term sustained people in the property, but it does give you people who have training and who can come in and intervene and do crisis intervention and do their thing.
Yeah, no, that's what I was saying about anchors have a wide range of assets. It's, time, talent, and treasure that get deployed in various different ways.
There was a question over here, I think.
I just have one follow-up to that comment really quick.
Yeah, quickly.
So the university partnerships that used to be funded by HUD in the 90s, is that something that Ben Carson is considering? And is that something that we can maybe look forward to? are we pitching it today? I don't know.
I didn't catch it.
I was just asking if the University Partnerships Program.
I am not aware
Yeah.
of anyone. We could chat with him about it today,
Yeah.
perhaps.
Yeah. Appropriations of
Let's
like
keep
for a
going
long
around.
time.
Let's keep going around. Next question. Somebody over here had a question, I think. Okay, over here then.
Hi, Greg Russ from the Minneapolis Public Housing Authority, and the question's for Sue, and hi, Sue. So listening to the conversation, it's very, very interesting, and I'm asking a research type question. So we have a ton of stuff happening, and my question is kind of like, what is the minimum amount and mix of services that ought to be or could be employed to begin to move a family forward in some way? And the reason I'm asking is we can get this service or we can get that service, but it's very hard to get them all together. So
Yes.
how would you, is there any research at all on sort of the, I can't think of a good word for it, maybe the intensity of the service level and the mix that would sort of guide, okay, here's where we are at the start of the program, we're going to do these two things because that's what we can afford, but then as the program advances or the anchor institution begins to contribute more, and is there any way to help guide that thinking?
Yes, that's what our Host in Action Network does, exactly. So thank you for letting, we have a website.
Is this a planted question?
And I think one of the things we've been doing in partnership with some of our, after the big demonstration, which was lushly funded by philanthropy, we have been working with housing authorities at a more sustainable level and thinking about what is sustainable and working on tiered logic models so that you are targeting the people who need it most with the most intensive services, but you have lighter touch services available for people who maybe lost a job and need a crisis intervention to not get evicted or to have food, but don't need ongoing and don't want ongoing coaching, a sort of middle tier for people who might need help for a couple of months to stabilize, and then the most intensive services for people who need long-term support. And we're working with one housing authority that's using their FSS program to build off of and partner with youth serving program. So I'm delighted to talk to people about strategies for building those kinds of models.
Do you want to add anything? I would just say that just to underscore this point, that measuring the effect, the impact, given that you've got different choices of how to add services, to housing, or to employ, to utilize an anchor institution in various ways. There are a lot of gaps in the research. I think we'd all agree on that we know a lot more about some areas than others. When you start looking at alternatives, it becomes even more challenging. And this is really important to get right, because if you're trying to make changes in budgets, if you're going to go to a state, a county, state, or the federal budget and say, we really ought to be employing funding differently to encourage these kinds of hubs in certain areas and to address the budgetary issues that they have, you've got to have pretty good, at the very least, you've got to have good evidence, let alone the politics of sometimes moving money around. And there's still a lot that needs to be done. So those of us like Sue and myself and others in the think tank community and the university community have a lot to do, I think, to help facilitate this area of work and get anchors more effectively used. Okay, any other questions? Yes, there's a question over here.
Thank you for this discussion. Many of the institutions you're describing are public, nonprofit, or otherwise heavily funded by public monies. What does the law have to say about their obligation to engage the communities in the ways you are describing?
Okay. You want to talk about that?
Well, there's been some uptick in the health sector and changes to how nonprofit health systems have to report their community engagement. It's still quite broad, but things that they can count range from participation in local conversations around neighborhood improvement to actually making investments and other sorts of things. So there's more visibility and accountability there, but it's not specific. So.
Yeah, likewise, universities, to maintain their nonprofit tax-exempt status, have to do things to advance the public good or social benefit, but there's very little requirement within the actual regulations that specify what that is and how it is to be measured. And that is, I think, one of those key things that is part of this anchor movement, is that it is about being able to develop some sort of fine-grained and nuanced detail about the positive and sometimes the cautionary effects that institutions of various kind have on communities.
Yeah, there are certainly a number of incentives and requirements, has been said. I mean, you look at the nonprofit hospitals, the community health needs assessments that they have to do to say what's going on in the community and what are they doing to ameliorate some of the issues. We see, of course, in the financial community, too. I mean, way back to the Community Reinvestment Act, requirements on financial institutions to explore ways of helping to support and fund low-income communities. And more recently, with the new Elementary and Secondary Education Act, in those areas where there's failing schools, there's now a requirement on the school districts and the state to start at least exploring some of the factors that may be causing absenteeism, poor results in the schools. So there's an opportunity in terms of nudging through the requirements of the federal law for this. I think one of the concerns with the nonprofits is that the people doing the regulations is the Internal Revenue Service and the Treasury. They're not always the most up-to-date on exactly the subtleties of the kind of things we're talking about here. And there are people in town like Sue Rosenbaum at George Washington University and others who are really trying to help the Treasury kind of understand the very things that we're talking about today. We should have Treasury officials here to understand what the possibilities are so that those kinds of incentives and requirements can be better tuned. I think in the case of hospitals, you find a lot of hospitals who are interested in playing this role, but they're not sure whether they will get credit, if you like, against their requirements for this. So there's a lot of uncertainty there, which I think tends to make them risk averse in this area. Do we have any other questions? I think, let's see, over there.
Thank you, and good morning. I have a question of enlightened self-interest. I'm a longtime Housing Authority Executive Director who left to think full-time about housing and education and healthcare. And my group, among other things, is stewarding the brilliant idea that Nancy Andrews, the recently retired executive CEO of the Low Income Investment Fund, described as a Healthy Start voucher, which would bundle housing and healthcare and education together. And so as the heir to that idea, I'm wondering if it resonates with you from a policy perspective, and then practically, do you think it needs to bubble from the ground up, or could it come as policy from the top down and forcing that collaboration that's so essential?
I would just say quickly that this notion of how can we get some of the money that's at the moment siloed to particular activities, kind of pooled together in some way, blended or braided in some way, something we're particularly looking at in terms of how one would do this. And a voucher kind of idea, say, let's take a certain amount of money from each of these different sectors and pool them together and let a person use that in some way is one area of interest. Another is to look at intermediaries that can play a role of bringing money from different programs together, and also the private sector, and then distributing that, using that in more creative ways and more customized ways, the kind of things going on. Charles is very familiar, I'm sure, with the Family League of Baltimore in Baltimore that plays this intermediary role to kind of pull money together. So I think there are a number of opportunities like that. And if any you want to add to that.
Well, one thing that occurred to me listening to the conversation earlier was something that was an initiative a few years ago called P3, public-private partnerships, right, for
exactly. That was a statutory.
Right, and it was a statutory program that was quite baroque at the federal level. But it dealt with, like many programs of that era, it sort of recognized places where local community actors were coming together to address complex problems of specific populations. In this case, youth disconnected from work and school. And we're also bringing their states and state agencies into the mix, and there were several state agencies usually implicated by the programs that were needed, so you have that level of complexity going on. So where all of those pieces were put together behind a concrete strategy locally, there was the opportunity to request waivers from all the relevant federal agencies to then do, so it's sort of like a mini MTO, but population focused, or MTW, but across sectors. And then there was some technical assistance funding and also some evaluation funding attached to it from some of the participating departments. So as I say, very involved at the federal level, but it was more about flexibility than money.
Right.
And it was aimed to demonstrate some good cross-sector results. And that would be the kind of thing that might be needed here, I think, rather than one program in one sector.
We just got 5 minutes left, so I'm going to have one last question, but then I'm going to have a lightning round at the end. And I'll give a heads up. The Secretary of Housing and Urban Development is about to speak. If he could do one thing, or if the federal government could do one thing to encourage the anchor institutions we've been talking about, I'm going to ask each of you after the next question to answer this. What would be the one thing you think that he should consider doing or encourage to be done? But before you answer that, let me see if there's one last question. I think there was one over here. Oh, okay. Any other? Okay.
Oh,
here we go.
Hi. Freya Spielberg. I'm the Chief of Family Medicine at the Dell Medical School in Austin, and also am working in DC developing health interventions and housing projects. And I just had a comment regarding the difficulty of evaluating the interventions that we do. And I think that there are a couple things that are needed to help us move forward. One thing that we're doing is starting with door-to-door household assessment of people's health needs, social determinant needs, and with that data, not for research, but for designing care plans, we're able to monitor these things over time. And the thing that needs to happen to make that sustainable is finance reform so that community health workers can get reimbursed for doing those kinds of services in housing projects. And there's some movement forward. For example, in DC, My Health GPS program, funded by Medicaid, does finance community health workers, but that's something that has to spread nationally. And then the other piece that's going to be really important that I'd like to see, all of us work on is in health information exchanges are critical, and every community is kind of struggling individually to get something off the ground that's functional. So we need to find, and promote kind of national resources and standardization of that, but we also need to think about integrating data from housing and from the schools into those health information exchanges so that we can really use the data both clinically, but to evaluate.
I think that's a very important point, which I'm
time.
sure will come up when you start looking at this. I mean, I think there's been a lot of interest in existing information systems, like at hospital-based, to say, can they in fact, maybe under contract, maybe this is an area where budgeting is really important, we can get hospitals to start looking at how to integrate other data, given that they are focused on privacy and so on, and address those issues. We got 1 minute, so this really is a lightning round. So one thing that Secretary Carson could do to help further what we've been talking about this morning. Sue?
Well, I can think of so many things. This is hard. I guess thinking about the challenges of making sure that housing authorities have some source of sustainable funding. It doesn't have to be a lot, but that they can use something like Ross that they can use to leverage these partnerships.
Okay. I had a feeling one of you would say that.
Federally mandated economic inclusion strategies, so that when every dollar that goes in for federally mandated economic inclusion strategy, so that a chunk of every dollar that goes into rebuilding or creating new housing actually flows into the community and not somewhere else. And very quickly, the Community Outreach Partnership Center program being refunded.
So with appropriations and without, I would say for universities, as we discussed, having that very decentralized funding structure, even within the institution, as well as one by one nationally. I think community outreach partnerships, with a bit of a broader application as sort of community hubs would be useful. Without appropriations, I think there could be a lot of information dissemination among HUD grantees through the TA program that would help people understand how to engage and work with anchor institutions in their communities. And that would be a fairly easy thing to do.
Good. Well, I want to thank our panel of leadoff hitters this morning, like Bryce Harper the other day. They scored home runs. I don't know if Charles understands that coming from Baltimore, but anyway. New York Mets. Oh, Mets fan. Oh, even worse. Oh, God. How would anybody admit such a thing? So I want to thank the panel and thank you and have a great conference.